How did you sort of make the shift towards endocrine surgery? Because obviously you were busy, you did lots of general surgery.
When I think back, I really don't, I remember as a medical student that I wrote a paper on MEN1 was coming out at that time. I wrote a paper on that.
Wow.
And then as a resident, Stan Dudrick and I were in the lab at the same time. Stan was working on the puppies, and I was working in Jerry Peskin's lab, and we were doing, and got very interested in GI peptides. And at that time, calcitonin was, or it was called thyrocalcitonin. That was very, very exciting. And so I did work, and we actually published a paper, the first paper I think that I published in the Journal of Clinical Endocrinology and Metabolism was taking blood from the middle thyroid veins, injecting it into rats, and in some cases it went down, and it was published as calcitonin-like responses from human vein, from the thyroid veins. And it was a very interesting paper. Maybe we should get back to that.
Right.
And I met at Penn at that time, Claude Arnault was working with a man by the name of Harold Rasmussen, who was a great man in biochemistry. And Claude Arnault and John Potts up here were the two rivals and trying to purify parathyroid hormone. And so Claude Arnault came in one time with a pipette with about 50 pieces of glass in his hand, and we took out all these little pieces of glass, and we became friends. And so
From his injury?
From his injury, he had all the glass from the pipette.
Right.
And he was working with Harold Rasmussen, and we got interested in talking about calcitonin, parathyroid hormone, GI peptides. And I went up to the Mayo Clinic then after I finished my residency. I spent a year at the Mayo Clinic with Claude Arnault. I was his first fellow in endocrine research there.
Wow.
And Jean Maybury, who became the head of the board of directors and whatnot, was in the lab doing thyroid research, and it was a very exciting period of time. So when I was up there, we actually found calcitonin in the adrenal medulla of the pig.
Wow.
So both immunologically and biologically, and some pheochromocytomas, for example, have been found to have calcitonin in the MEN2 syndrome, and that's been published and whatnot. So I think that was very interesting. And I had a very interesting thing when I came back to Chicago, that I worked at Michael Reese Hospital with Jerry Peskin. Went out there to be the head of surgery. So in 1968, I went back there. Eric Reese, contrary to what Patricia Newman said, that Eric Reese had the first PTH assays.
Oh, okay.
And so they had a chicken at that time that had a good antibody, in other words. And so we were able to measure PTH, and we published papers there, and I was very interested in calcium ion. We published a paper that got published in the JCI, for example, when taking a gram of phosphate made the ionized calcium fall and the PTH rise. And very, very exciting times at that time. And so Claude Arnault was working on the calcitonin assay at that time, and parathyroid hormone purification. So I was really sort of in the middle of the whole aspect there.
Yeah.
And knew used to go to all the meetings, and knew John Potts. John Potts was a Penn guy as well.
Okay.
So he and I were friends as well, although he was a few years older than I.
Right.
So it was really a very exciting period of time at that time.
Pardon me.